2 choices for Radiosurgery New York.
News Talk Radio 710 WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. Rob, we're back. Can you believe it?
I do believe it.
You know, what was interesting at the meeting also was the analysis of data. And there's a lot of frank talk and scientific talk. And, for example, with CyberKnife, what was amazing to me, CyberKnife has been advertising very aggressively about treatment for prostate cancer. CyberKnife was developed by a friend of mine, and they use a robotic arm and treat different cancers. And it's very expensive treatment also. And they're pushing it now for prostate cancer. It was designed for brain tumors. It was designed to copy our work, really, I believe. But there's only been 200 men treated and followed more than 5 years for prostate cancer.
Small number.
So it was another one of those diseases where you have a very common disease, prostate cancer. You have 250,000 men a year diagnosed. They haven't had a randomized study. They're promoting it very heavily, and it's a different kind of treatment using 5 treatments. And most people still consider it experimental, but they only have 200 men out in published data more than 5 years. And the problem when you promote data and technology like that is that you have a little follow-up, and most men have a great chance of being cancer-free from their prostate cancer. Our goal is to try to cure that man. You take a 60-year-old man, and he should live another 20, 25 years.
Sure.
So when you have very little follow-up, you don't really have any information to provide the man and his wife or loved one. What's going to happen to him? What's the chance of success? And there's been a lot of reluctance in the radiation scientific community to go out and promote CyberKnife without that scientific data, without randomized study, and without long-term follow-up. It's one of those things that's very interesting that you'll never hear from the advertisements is that there's no randomized data. There's very little data out 5 years. And most of us want data out 10 years, 15 years, 20 years.
Right, the more the merrier.
The longer, the stronger the data.
Right.
So it's something that's really something to think about as you're getting diagnosed with prostate cancer. And that's why I tell people they should have a fresh second opinion, because you really should have someone talk to you in a different kind of way than what you've already been talked to, so you make sure that whatever your decision is, it's the correct decision for you. We had an interesting patient who's a Jehovah's Witness.
Okay.
And Jehovah's Witnesses are people that do not want blood or blood transfusion, blood products.
Right.
Right.
It can be especially tricky sometimes.
It is tricky because sometimes they have cancer and the doctor may tell them they need to operate. Now, this week we had a man who's Jehovah's Witness who had cholangiocarcinoma.
Yeah.
So it's a cancer of the bile duct system.
Sure.
And it actually had spread. So he was seen at some big hospitals in New York, and they wanted to operate on him, even though he didn't want surgery. He refused surgery, and he refused blood. And so he came to us on double narcotics. So he was on a lot of pain. He's a 50-year-old man and a lot of pain, and a large mass by the celiac plexus and pancreas. You can imagine it's probably growing through the nerves, causing great pain.
Yeah.
Like people who have pancreas cancer.
Right.
And he liked the fact that we don't cut, we don't cause bleeding, we don't operate, we don't put people in the hospital. Our work is all outpatient. And he got 2 treatments this week, and his pain is already better. So it was a nice story for him that we were able to treat this large mass. He had no side effects, and his pain is improved. So when he came in, he was doubled over in pain, and he walked in on Friday feeling pretty good. Friday morning was his second treatment. So it was his first day that he'd come after the first, and he was already better.
Wow, that's excellent.
So it was nice. It was really nice. The bus driver man who I talked about, the squamous cell, reminds me of the woman that we treated who was on hospice. So skin cancer affects a lot of people, and I think that we don't probably talk about it enough in our society because we can do things to avoid skin cancers.
Right.
Now, you've got nice, fair skin. You probably stay out of the sun.
I do.
And you wear a hat or sunscreen.
I do wear sunscreen.
Yeah.
Yeah.
So most people don't think about it, but even when you go out to grocery stores, you probably put some sunscreen on your hands, on your face. That's where you get most of your sun exposure nowadays.
That's
Or
right.
put on a hat. So we had this woman who was on hospice for her cancer. She had a very, very, very aggressive cancer. She was on hospice for a skin cancer. And the doctor who I knew that we took on difficult cases. We treated her. She got off hospice, and she's home now.
That's excellent. That's really good.
Yeah, she had cancer from her ear to her eye down to her cheek and mouth. And we treated it, and she's better and home, out of hospice.
She must be grateful.
I think her family is.
Yeah, yeah.
You know, I don't think she likes treatment too much. Otherwise, she probably would have got treated years ago, but she's doing much better. And we had another interesting call from overseas with a patient who had acoustic neuroma.
Mm-hmm.
We have the largest experience in the world treating acoustic neuromas with fractionated radiosurgery. It's a unique program that we pioneered. Acoustic neuromas are benign tumors of the 8th nerve.
Right.
The brain, the body has 12 cranial nerves, right?
Yeah.
So do you know why the 8th nerve gets more schwannomas than all the other nerves?
I don't.
I mean, there's longer nerves. You know the longest cranial nerve?
I can't say I do.
I think it's the 6th.
Okay.
I think it has the longest.
I would have guessed the probably like the 12th.
Yeah, I think the 6th has the longest, I believe. You can check it out and tell me if that's correct. So it's not related to length. Unlike people, we talked a couple of months ago about taller people have more cancers than shorter people, and it may be because their organs are bigger.
Right.
But this is not that case. It's not the longest nerve or the biggest nerve. No one knows the cause of it. But for whatever reason, it's a benign tumor usually. It causes hearing diminishment and imbalance. And actually, we had a man come in to the office this week. He heard about hearing and balance and came in for a consultation because he wanted to know if he had an acoustic neuroma.
Okay.
And he was 70 years old. He had profound hearing loss, and he could barely stand up.
Yeah.
Hearing loss on one ear.
Okay.
So acoustic neuroma is usually unilateral.
Yeah.
So if you're operating a jackhammer and both ears are bad, that's something else. But we sent him for an MRI with contrast of the brain, and hopefully we'll know in the next week or two. We'll report back if the show saved his situation. Anyway, we're almost at the end of the hour, but if you have questions, you can call us at 800-321-0710, 800-321-0710. During the week or the rest of the time, if you have questions or you want the free booklet and DVD, just call us at 212-CHOICES, 212-CHOICES. The real number is 212-246-4237. 212-246-4237. about any question you have concerning cancer, screening, workup, best treatment, etc., or just to talk. There was an interesting observation. You know what the robotic surgery is for prostate cancer, the Da Vinci method? Have you ever seen that machine?
I haven't seen it in real life, but I've heard about it.
Do you know how it works?
Yeah, basically an operator sits at the console and then...
So he's sitting far from the patient. The patient may be in
Right.
another room or across the world, and he's sitting at this console. And what is that? What's he doing exactly?
he's basically controlling the hands.
How does he do
Right.
that?
With his hands, right? Through
So his hands are in something like a glove or a sock,
right.
and if he moves, the machine moves.
Yeah.
And if he doesn't move, the machine doesn't move.
Right.
And there's lights and there's cameras inside the patient's body.
Yeah.
And we talked last week how there's a lot of perforations and side effects from
Yeah. That's right.
puncturing the intestines or the rectum because the doctor can't really feel like a normal person. I mean, a normal surgeon has his hands in there and he can feel the rectum, he can feel the intestines, and he probably knows where to stop. Where if he's sitting far away and his hands are inside some kind of steel glove,
Yeah.
you can't really feel what you're going after.
Yeah.
And yet you have a knife and you have clips, and so you can do great harm. And that's why the government gave an advisory about robotic surgery, Da Vinci, that the complication rates are a lot higher than those reported. Anyway, at the meeting, it was interesting. At the radiation meeting, they did not call it robotic surgery because robotic surgery is like the car that Google makes. You program the car to go from Los Angeles to New York, and it drives itself, right?
Yeah.
It sees red lights and turns left and turns right and stops and goes, and right?
Yeah. It controls itself.
And so the robotic surgery for prostate cancer is not really programmed to do that. And so the doctors actually at the meeting called it puppet therapy. And they said it was a great marketing device to call it robotic surgery, but it's really puppet therapy because your hands are in something like a puppet and they're moving, trying to emulate your movement.
Yeah.
And that's why the complication rates are so high. Anyway, we're at the end of the hour. Tonight we have a special program, Dr. Paul Offit. We're going to be talking about why vitamins and antioxidants may cause 25% higher death rate in cancer patients, so it's important to tune in. During the week, please call us at 212-CHOICES, 212-CHOICES. Thank you for tuning in. Thank you, Rob Spencer, for a great program. And we're going to have more news next week and more news tonight and on WABC Saturday at 6:30 a.m.
Thank you, Dr. Lederman.
Thank you. Good. Have a great week and have a great day, everybody.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.